Good morning. Happy Sabbath once again. All right. I'm going to read just a couple of news clips that came out within the last couple of weeks or so. And actually, this first one, and once again, you can go and look at these news clips yourself at pcrm.org. And you click on news and you click on the health topics. Sorry, you click on the news tab and then the health and nutrition news. And you can find all this there. You can read it for yourself, and then you can actually take that reference and research it yourself. That's the most important thing. All right? So this one was published on April 1st, and this is no joke, by the way. And it reads this. The title is Processed Meat Consumption Linked to Cardiovascular Disease and Death. That sounds yummy. All right. So it says consumption of processed meat is linked to cardiovascular disease and death, according to a study published in the American Journal of Clinical Nutrition. Researchers reviewed food intake records from more than 100,000 participants. Wow, it's a big study. In this prospective urban-rural epidemiologic study, or the PURE study, and compared heart disease and mortality with meat consumption. Those who ate more than 150 grams, and apparently one hot dog is 50 grams, so 3 hot dogs, all right, of processed meat a week had an increased risk of heart disease and death by 46 and 51% respectively. Wow. So 3 hot dogs can kill you faster. Yummy. All right. When compared to those who did not eat processed meat, these results support limiting processed meat intake for heart disease prevention. All right. So we are what we eat. Is that a surprise? No. All right. Excellent. All right. Just picking the next one. Egg consumption. It says egg consumption increases the risk of all-cause and cardiovascular disease mortality. Oh, that sounds so delicious. Wow. According to a study published in the European Journal of Nutrition, researchers compared egg intake with mortality risk in 20,562 participants. So no small study, with no cancer or heart disease diagnosis from the Molly-Senai study cohort. After a median, after a median 8.2 years rather, those who consumed more than 4 eggs a week increased their risk of death from all-cause heart disease and cancer when compared to those who consumed 0 or 1 egg per week. A moderate intake of 2 to 4 eggs per week increased the risk of cancer mortality and all-cause heart disease mortality by 22 and 43%. For participants with hypertension and hyperlipidemia, an increase of 1 egg per week increased mortality risk. Higher dietary cholesterol and cholesterol from egg intake accounted for the increased mortality risk. The results suggest that dietary guidelines discourage egg consumption, especially for high-risk individuals with hypertension and high cholesterol or hyperlipidemia. So, wow. We are what we eat, once again. Amen. And so the bottom line is that when we look at foods, it is important what we eat because it does influence our body's nutrition and how we handle certain things that come along. Which kind of runs into the last article we're going to briefly look at. This was dated March 18. And it says, infected again, a study shows that previous COVID-19 infection confers only partial protection. And so I did look at the abstract of this one, and it didn't go into a lot of detail, but basically what happened was that they looked at the Dutch nation, because apparently there, when you get your vaccine or when you get tested, you're in a registry, so they can trace you, and so they're able to. This is kind of made it kind of a unique group. And so, anyways, they found that individuals over age 65, infection with COVID-19 confers only partial protection from reinfection with the coronavirus, according to the new study in Denmark, reported in the Lancet. And they looked at 11,000 individuals. The long and short of it is that the previous infection cut the rate of infections by 80% among people under age 65, but only 47% among age over 65. The researchers point out that given the older people are particular risk for COVID-19 mortality, additional protections remain essential. And they make a note here at the bottom, and they said, listen to this, dietary improvements, particularly the low-fat, plant-based diet, remain the cornerstone for managing the underlying risk factors of obesity, diabetes, high blood pressure in particular, that make COVID especially deadly. So what we eat can influence how our body reacts when we become infected with any virus. And when I was listening to a talk about even influenza virus, okay, which apparently disappeared this year. It's interesting that when people with influenza virus who have high blood pressure, high cholesterol, and diabetes, and heart disease, guess what? They are at risk, increased risk for death from that virus. And so it's no surprising that people have died from this thing because we are a sick nation. And so to get absolute true health, we do need to take make changes in our diet that will influence good health, therefore decreasing our risk from the virus or any other cause. And so what we do eat does influence our body in multiple ways. And it needs to be done in a healthy way. You need to enjoy your food. You know, if we were doing this, Sharon could probably vouch, 15, 20 years ago, a lot of the foods were kind of blah, But now there's so much good stuff out there, and it's easy to get to, And so I would just encourage you, because it does taste great, and it leaves your body in such a better health. So if you do get an infection, it'll be less of an issue than if you didn't have good health. So that's the bottom line.